Hello, my name is Elby. In this presentation, I will give you an overview of the process for submitting an IRB for expedited or full board review. In general, expedited and full board review occur when research is designated as more than minimal risk. According to federal regulations, research is considered minimal risk if the potential harm or discomfort to participants is no greater than what people experience in their daily lives or during routine medical or psychological procedures or tests. In expedited review, the IRB chairperson or one or more experienced IRB members who are designated by the chairperson review proposed research in lieu of review by the convened IRB. This allows certain proposed minimal risk research to be reviewed without waiting for a meeting of the convened IRB. Expedited review can also occur when there are minor changes to approved research. The key here is that the research poses no more than minimal risk, and all procedures and methods of the research are included on the list of categories maintained by the Department of Health and Human Services. A full board review designation means that the research is greater than minimal risk and is not eligible for expedited review. We use Kuali to manage the submission and review of IRB applications. You can access the login to Kuali from the CSUP IRB website, just clicking here on the blue button that says log into Kuali. You will be asked to authenticate using Duo. Once in Kuali, you'll see a list of any protocols that you have started, either active or in progress. You can see here that I have 3 protocols in progress. To create a new IRB application, click on this blue button in the upper right-hand corner that says Add New Protocol. The first thing that you will be asked to do is enter the information of the principal investigator. Kuali does not allow for co-PI. There will be one person who acts as principal investigator, and then if you are collaborating with other researchers, they will be listed later as co-researchers. I'm entering my last name here and the information auto-populates. You can see that I'm listed here by my legal name, not my preferred name, and that my CSUP email address also auto-populates. Selecting my name here will add information to the lead unit section also. If for some reason the lead unit does not auto-populate, or if it populates incorrectly, please reach out to the IRB via our email at csup_IRB@csupueblo.edu. It's really important that you select the correct campus. You can see here under lead unit, I'm listed in the psychology department, and then you can see this identification number, PB for Pueblo-P216. If the lead unit does not auto-populate with PB, it means that your protocol is being sent to Fort Collins for review, but CSU Fort Collins does not have the authority to review and approve IRBs from CSU Pueblo employees. The Kuali protocol system is built using conditional input. Essentially, this means that you will only see the fields that are relevant to your research. This is the point at which the conditional input begins. In this screencast, I'm only describing expedited and full board applications. If you're uncertain which to select, reach out to the IRB to discuss your research plan. Also note that just because you've designated your research as expedited, if the IRB reviewer deems the research to be greater than minimal risk, it will be redesignated as full board. Because the templates for expedited and full board are similar, I'm just going to select expedited here. And now you can see a new list of screening questions has populated. You'll scroll through and answer each of these questions based on your research question and design. And here you have entered the full protocol where you will answer questions about your research. The first step is adding all research personnel. In general, anybody who is going to have meaningful participation in data collection needs to be included in this section. Let's say I'm collaborating on this research with a co-investigator who also works here at CSU Pueblo. To add this person, I'm going to click on the plus sign add line here in the upper right-hand corner. And the additional protocol personnel window will pop up. You can search for their name and home unit here. So I enter my co-investigator's name here. I'm typing in my current co-chair, Vicki Boley, for this demonstration. And then I search for her department, teacher education, with Pueblo as the home unit. Now, if I wanted to swap roles here, I could list Vicki as the principal investigator and change my role to the co-investigator. For this demonstration, I'm just going to leave it as is and list her as co-investigator. Here, I need to indicate which study procedures or activities my co-investigator will participate in and provide a brief description of the study procedures. I've indicated that she will be administering surveys and participating in focus groups. You can see I've also granted Vicki full access, which means that she would be able to log into Koali and collaborate on this IRB application. If I were to select read only, she would be able to see my work, but she would be unable to contribute or edit anything directly. And next, I need to upload evidence of ethics training for all research personnel. I do this by selecting the Add Info button, and the Add box pops up. So you can drag and drop or select a file from your desktop. I'm going to select the Add Choose button. And then I select the city training for my COI and hit Open. Please name the attachment. This will serve as a label for the IRB reviewer to quickly access the necessary document. You will also select one of the attachment type labels from this drop-down list, and optionally, you may add a comment. Once you have completed these steps, select Done. So you can see here that we have successfully uploaded the city certificate for Dr. Boley. Remember, though, that you need ethics training for all study personnel, so I need to follow these same steps to upload my own city certification. In line with CSU Pueblo policy and federal regulation, the principal investigator is the person responsible for writing an accurate and complete proposal. Student researchers can be included in the research proposals as co-investigators, but they must list their advisor as the PI. This is the case for both undergraduate and graduate students. If you are collaborating on your research with colleagues external to CSU Pueblo, you can add them here. Examples for people you might add in this section include faculty at another university, or a co-investigator who works in the community or at a local school district. You add them in much the same way I demonstrated above, clicking the Add Info button and filling out the necessary information. If you have multiple external collaborators, you can add more by clicking the Add line and then entering their information. And here we are moving through the section of the application, the general questionnaire. This is what you filled out when you opened the protocol. You can access it here if you need to make any changes. For example, perhaps you selected that you are not receiving funding, but then ended up applying for a research grant. So you could make those changes to the general questionnaire so that the appropriate fields populate in the application. I am not actually going to make any changes to the general questionnaire, and instead of scrolling down, I'm just going to click here on the locations button below general questionnaire to proceed to the next section. Collaborators are different than external personnel. The difference boils down to the research relationship. If I have a co-investigator at, say, Mesa State who is conducting the research at their institution, they're considered external personnel. However, if I'm collecting data from multiple universities but not working with a specific co-researcher from those universities, then I have research collaborators. Ultimately, the difference is the responsibilities of the collaborator or the co-investigator and the access they have or they do not have to the data. In this hypothetical scenario, I have a survey that I will be distributing at 3 universities. The survey has electronic informed consent embedded as the first question. My collaborators will administer the survey, but they're not screening or consenting participants, and they do not have access to identifiable private information. The next section is funding information. You can select the Add Info button, which will auto-populate state and federal funding agencies. You will click on the funding type and then select your funding source. Here I'm selecting industry or privately sponsored. And now you can type in your specific funding source and select from the drop-down list. If you cannot find your funder, click the I cannot locate my funder checkbox and enter the information manually. Here, for this example, I'm selecting Pueblo County. You'll need to include information like the proposal or reference number, the title of the grant, the period of funding, and the location of the study. And when complete, select Done to move to the next section. Okay, this screen is populating because in the general questionnaire, I indicated that I will be accessing existing data, meaning data that had been previously collected either for research or for non-research purposes. Examples of existing data can include individual records like academic or medical records, existing data sets, interview notes, social media posts, etc. For this example, I've indicated that I'm planning to include student progress and retention data, along with a plan to access those data. Indicate whether the data were initially collected for research purposes and whether the data are coded. Selecting yes to either of these questions will prompt you to provide more information. Why were the data collected? How are the data going to be coded or decoded for use in your research? If you are a graduate student and your study is being conducted as part of your thesis or dissertation work, we encourage you to share your data when appropriate. This is not a requirement, only a recommendation. We also encourage you to create a standalone data management plan. You can access either of these data management services by clicking these links, and you'll be able to walk through a fairly straightforward process for creating that data management plan. The next section is compensation and cost. If there's any compensation for participants, it needs to be listed and described here. Be sure to include the plan for remuneration or how and when participants will be compensated. For example, when will the participants be paid? Will payment be prorated based on number of interactions with the research team? If participants are being paid $600 or more in one calendar year, you will need to ensure that participants have a 1099 on file with Colorado State University Pueblo. If participants will incur any costs to participate, that needs to be disclosed here as well. Selecting yes opens the dialog box to explain the costs that will be incurred and a reminder that this information also needs to be added to the consent form. Because your research falls into the category of either expedited or full board review, you will also need to submit a written protocol. You can access our template on our CSU Pueblo IRB website under Investigator Resources, or you could use one of the NIH templates available at the link provided. If there are other attachments that are required, you will get a notification here. For example, if you have a federal grant, you would be required to upload a funding agreement. Any document that a participant or potential participant will see must be reviewed and approved by the IRB. This includes all recruitment materials, consent forms, any communication like language for emails or scripts for phone calls, etc. The exact documents required will depend on your specific research question and research design. This document is the template for the written protocol. It's meant to be a guide, not a fill-in-the-blank document. Remember to keep an electronic editable copy of this protocol. If the IRB requires any changes or additional information, you will need to be able to modify the original and save a new copy to upload to Kuali. Work your way through each section of this written protocol, and remember that you can enter not applicable or NA if the section does not pertain to your study. I'm going to give you a brief overview of the various sections in this document, but do make sure to read each section carefully to ensure that you are providing information relevant to your research. As you build out the protocol with your research information, the page numbers in the table of content will shift. As long as you do not adjust the formatting and headings, there's a really simple way to correct this. Rather than manually updating each page number, you can click on the table of content field, make sure that it selects all rows, and then right-click to select Update Field. The new page numbers for each section will populate. As you work through each section of the written protocol, please reach out to the IRB chairs if you find anything confusing or unclear. One question we sometimes get is, what's the difference between objectives and endpoints? Objectives include the purpose of your research, your hypothesis or hypotheses. In the endpoints, you'll describe how you know whether and when you've met your objectives. In my field, psychology, we more commonly call endpoints the operational definition. So how are you defining and measuring the variables in your study? In the procedures section, you'll go into detail on your study design with a description of all procedures performed, the timeline of procedures, and how you will monitor participants for safety or otherwise mitigate the risks of the study. You can include images or tables in this section if appropriate. If you're storing data or specimens for future use, you'll need to detail how those will be stored and protected, and how they will be accessed in the future and who will have access. If this section does not apply, you can simply indicate that and move on to the next section. If you are sharing the results of the testing with your participants or with others, like, for example, their primary care physician, you need to describe exactly what is being shared and how and when that information will be communicated. Describe your study timelines, including your timeline for enrolling participants, the individual timeline for participation, and the estimated run of your study, like how long will it take to complete data collection. You will also detail your inclusion and exclusion criteria and screening procedures. This section also includes your interaction with any vulnerable population. You can see this section has hyperlinks that will further define and describe the potential vulnerable populations. In section 12, other populations, you will disclose recruitment of or interaction with other populations that are not categorized as vulnerable, but that are still afforded extra protections. These include pregnant women and students, especially students that are in any of your classes. In section 13, you will tell the IRB how many participants you're looking for, and if applicable, you will distinguish between how many participants you anticipate being enrolled and screened, and how many participants you need in order to complete the research. Account for attrition, account for dropout rates, account for screening failures in this total number. In section 14, you will describe your recruitment methods, including when, where, and how potential participants will be contacted, how you will access potential participants, how you're identifying potential research participants, and any compensation or any potential risk to those participants. In section 15, describe any anticipated situations in which participants would be removed from the research without their consent, along with steps for orderly termination or removal. In section 16, describe any potential risk of harm to participants and be clear with regard to which procedures pose that risk. Also describe any potential risk to non-participants, if applicable. In section 17, describe any potential benefits to your participants, along with the probability, magnitude, and duration of those benefits. Describe potential benefits to the individual participant, the population, and to science, society, or humanity in general. In section 18, describe your data management plan and data analysis plan, including any statistical procedures or power analyses that will be used. Section 19 is required if the research involves more than minimal risk. In this section, you will provide information about how you will monitor and evaluate collected data to determine the safety of participants who are enrolled in your research, along with how frequently such data will be collected, who will collect, and who will review that information. In section 20, you will describe the steps that you'll take to protect participants' privacy. Section 21 addresses any research-related injury. If the research involves more than minimal risk, you need to describe any available compensation in the case of research-related injury, and you need to provide a copy of contract language relevant to compensation for research-related injury. Section 22 asks for information about any potential cost or burden to your participants. And in section 23, you'll describe payment and the method and schedule for compensation, if applicable. In section 24, describe the full consent procedure, including initial consent and procedures to ensure ongoing consent. This section also asks you to describe consent processes for non-English speakers and describes the process for waivers or alterations of consent if applicable to your study. In section 4, you will also describe assent procedures for anyone who is not yet of age to provide consent, including children or teenagers. If your research includes cognitively impaired adults or adults otherwise unable to consent, you need to provide very clear information around how consent will be obtained, including any durable power of attorney or otherwise legally authorized representative. In section 25, describe the process for documenting consent in writing. In section 26, describe the setting or location where research will be conducted or where data will be collected. In section 27, describe any resources available to conduct the research, including the time you will devote to the research, your facilities, any medical or psychological resources that participants may need, and how you will ensure that everyone assisting with the research is adequately informed about the protocol and procedures, and that they are clearly aware of their duties and functions. Section 28 is for research that includes multiple sites. You will include study-wide recruitment numbers and recruitment methods. And in section 28, you will also complete additional worksheets detailing the research relationship between those multiple sites. Again, if this is not applicable to your particular research, simply indicate not applicable and leave this section blank. When you have completed your written protocol and have updated your table of contents, save it and get ready to attach it to the protocol in Kuali under Attachments. When you click on the Add Info button, this add box will appear. You can drag and drop a file to attach, or you can select from your computer. Make sure to label each item appropriately so that your IRB reviewers understand the purpose and population each document aims to address. This is the drop-down list for attachment type. Not everything on the drop-down list will pertain to your research, but do make sure to include all relevant documents. To add more lines, select the Add Line button on the right side of the screen and then edit or add information to that line. If you are submitting required revisions, make sure to delete the existing attachment and upload both a tracked changes version of the document and a clean version of the document for review. You can see on the left-hand menu that there are still 3 sections that are incomplete. You know that because they don't have a green check mark. Please don't try to submit until your protocol is complete, including all necessary attachments. When you have completed all sections of the IRB application, you will select the Submit button on the right navigation bar of your screen. This sends your application to the CSU Pueblo IRB for review. If we need more information or clarification in any section of the application, we will indicate what is needed as an action item and will return the protocol to the principal investigator for revision. Complete expedited protocols are typically reviewed within 2 weeks. The CSU Pueblo full IRB meets monthly, generally on the 3rd Friday of the month, and complete protocols that are submitted at least 1 week prior to the monthly meeting will be reviewed at that meeting. Please note, however, that if the IRB requires more information or changes to the protocol, it can take several cycles of full IRB review before the protocol is approved. For a timeline of upcoming IRB meetings, please see the CSU Pueblo IRB website. Please reach out to the IRB if you have questions. We are happy to support you in your research endeavors at CSU Pueblo. And thank you for your time in reviewing this video. We look forward to reviewing your IRB applications. Bye.